In today's tutorial, we are diving deep into Herpes Simplex Virus 1 and 2, HSV-1 and HSV-2. By the end of this video, we'll have a clear understanding of HSV-1 and HSV-2, including their clinical manifestations, diagnosis, treatment, and some interesting mnemonics to make learning easier. What is Herpes Simplex Virus? Herpes Simplex Virus or HSV belongs to the Herpesviridae family, a group of double-stranded DNA viruses. HSV is classified into two types. HSV-1 typically causes oral herpes or cold sores, but can also cause genital infections. HSV-2 primarily causes genital herpes, though oral infections can also occur. Both HSV-1 and HSV-2 establish lifelong latency in sensory ganglia and can reactivate under triggers like stress, fever, immune suppression, or UV light exposure. Transmission. How is HSV transmitted? HSV is spread through direct contact with infected saliva, mucosal surfaces, genital secretions, or lesions. HSV-1 transmitted via oral secretions, kissing, sharing utensils, or oral genital contact. HSV-2 primarily through sexual contact. Neonatal transmission can occur during vaginal delivery if the mother has an active genital HSV infection. Clinical presentation of HSV infections. HSV infections can manifest in different ways depending on their virus type and the affected site. Let's go through them in detail. HSV-1 Oral herpes. HSV-1 is most commonly associated with oral herpes. The primary infection, especially in children, presents as herpetic gingivostomatitis, a painful condition with vesicles on the lips, tongue, and buccal mucosa, often accompanied by fever and difficulty eating. Following primary infection, the virus becomes latent in the trigeminal ganglion and can reactivate later as herpes labialis, commonly known as cold sores. These are small, painful blisters on the lips that can be triggered by stress, fever, or sunlight exposure. In some cases, HSV-1 can lead to herpetic whitlow, a painful vesicular infection of the fingers commonly seen in the healthcare workers. A severe complication of HSV-1 is Herpes Simplex Encephalitis, which presents with fever, altered mental status, and seizures. It typically affects the temporal lobe, and diagnosis is confirmed via PCR of cerebrospinal fluid. HSV-2 Genital herpes. HSV-2 is the leading cause of genital herpes. Primary infection is often severe, presenting with painful genital vesicles, fever, and inguinal lymphadenopathy. The first episode can be prolonged and distressing. Following primary infections, like in HSV-1, HSV-2 also establishes latency, but in the sacral ganglia, and can reactivate periodically, leading to recurrent genital ulcerations. These recurrences tend to be milder and shorter in duration compared to the first episode. HSV-2 can also cause aseptic meningitis known as Mollaret's meningitis, which is characterized by recurrent episodes of headache, fever, and meningismus. Diagnosis. How to diagnose HSV? HSV can be diagnosed through several methods. PCR, polymerase chain reaction, the most sensitive test used for CSF in suspected herpes encephalitis. Tzanck smear, identifies multinucleated giant cells but is less specific. Direct fluorescent antibody test, also known as DFA test, detects viral antigens. Serology. IgG, IgM antibodies used to determine past exposures. Treatment of HSV-1 and HSV-2. HSV infections cannot be cured, but antiviral therapy can help reduce symptoms, shorten the duration of outbreaks, and lower transmission risk. First episode treatment: acyclovir 400 mg orally 3 times daily for 7 to 10 days. Valacyclovir 1000 mg orally twice daily for 7 to 10 days. Famciclovir 250 mg orally 3 times daily for 7 to 10 days. Recurrent HSV treatment: acyclovir 400 mg orally 3 times daily for 5 days. Valacyclovir 500 mg orally twice daily for 3 days. Suppressive therapy for frequent recurrences: acyclovir 400 mg twice daily. Valacyclovir 500 mg or 1 gram daily for severe cases. Mnemonic for HSV features. To make learning easier, remember this mnemonic. Her pet tiger eats very gently. Her for Herpes Simplex Virus. Pet for painful vesicles. Tiger for Tzanck smear multinucleated giant cells. Eats for Encephalitis for HSV-1. Very for vesicular lesions. And gently genital herpes HSV-2. Interesting facts. Did you know over 67% of the global population under 50 has HSV-1? HSV encephalitis is the most common sporadic encephalitis worldwide. Asymptomatic viral shedding makes HSV highly transmissible. Key takeaways: HSV-1 primarily causes oral herpes. HSV-2 is the leading cause of genital herpes. The virus remains latent in sensory ganglia and can reactivate. PCR is the gold standard for diagnosis. Acyclovir, valacyclovir, and famciclovir are the main antiviral treatments. Coming up next, we'll test your knowledge with 10 case-based questions on HSV-1 and HSV-2. If you haven't watched our previous videos on herpes viruses and the 10 MCQ revisions, the link are in the description below. If you found this video helpful, hit the like button, subscribe for more medical content, and comment below if you have any suggestions or topics you want us to cover. Turn on the notifications so you never miss an update. See you in the next video.